A lot of people write to me and ask me about what can you do with platelet-rich plasma in the buttocks. Since I came up with the vampire facelift now 15 years ago or so, that I've had the experience of putting platelet-rich plasma a lot of places, but more importantly, there are thousands, literally thousands of physicians and nurse practitioners over the past 15 years who have told me what they are doing and have shared their photographs with me. So this may not be the end all be all. I'm sure there will be more things thought about, but this is the best that I know right now about how to use platelet-rich plasma in the buttocks. So really there's four things to think about with the appearance of anything. It's the size, the shape, the color, and the texture. So when it comes to, we'll start with size first. If your goal is that you want to go from something like that to something like this, famous people who have used platelet-rich plasma had a picture of a champagne glass sitting right there. So it almost makes a shelf. To create that sort of volume, you need something more substantial than platelet-rich plasma by itself, usually fat transfer. Now, if you put fat mixed with platelet-rich plasma, the fat is more likely to survive. Of course, some people put implants in the buttocks. So you need structure to create that much volume. On the other hand, platelet-rich plasma has a propensity to greatly increase the multiplication, so the numbers and the size of adipocytes. Fat cells go crazy. What's the easiest thing in your body to grow is fat cells. And they will grow. So that's the basis of our vampire breast lift, the vampire wing lift, where we add more color and shape to the labia majora. But for the buttocks in particular, even though you can't do this, what you can do with it is what I call, so if you look at this heart shape, and on this part of the buttocks, it can become less round. It can be more flat. And if you fill that with platelet-rich plasma, you'll get a rounder shape to the buttocks so that this heart shape is more accentuated. And that is beautiful. It won't make a shelf, but from the side, what it would look like is something more like this. This will be enhanced. You still create a more beautiful, younger looking buttocks. The shape is enhanced, but you don't build a shelf with it. So if you want a shelf, you need fat or an implant. Fat could be mixed with platelet-rich plasma. If you want this part to be more round, then you can do that with PRP. You'll need at least 15 milliliters per side, which means that since you have to take the plasma out to enrich it, you'll need a total of 30 cc's of PRP, which means that you need to spend at least 60 milliliters of blood. So that could be done with lots of devices, but make sure whoever's treating you is using an FDA-cleared device to prepare plasma to go back into the body, because that's a different level and a different type of sterilization than preparing plasma. The best way to find someone like that is to find someone who's listed on our directory, who's licensed to use the name vampire breast lift, vampire facelift, vampire wing lift. So those are the things. Now, we left out texture. If you have dimpling from a scar from a cortisone injection, which happens sometimes if you inadvertently try to inject the muscle and it goes too shallow, it can cause a little divot that can be a depression. It looks like someone's poked their thumb and left an indent into the fatty tissue of the buttocks. It's pretty common. A lot of people get cortisone shots when they have the flu or something. And it doesn't mean you have an inept person, but it's definitely something that can be a side effect of a cortisone shot. This fills in beautifully with platelet-rich plasma. You can just squirt about 10 cc's of PRP into that. The adipocytes will fill it in with growth, and both in numbers and size, and this will smooth out beautifully, usually with one injection, and it will stay permanent. All of these this and anything you do to multiply the fat, whether it's the breast or the buttocks, if you lose weight, well, that's going to decrease the size and number of the fat cells. So assuming your weight stays the same, this will get better, rounder, this will fill in, and it will be permanent. Then the other thing, of course, that happens with texture is the multiple dimples that happen with cellulite. In that case, I think it's best to do some combination of microneedling, as we do with our vampire facial, and or undermining the tissue with a mixture of platelet-rich plasma and something like Sculptra. So the Sculptra has a place, I think. It's not so good. You can't use it in the mouth. It has to have time to develop, just like platelet-rich plasma does. Think of PRP as fertilizer. You wouldn't put seeds in a potting soil and then expect to have full-grown plants with flowers on them the next day. Things have to grow. So platelet-rich plasma is fertilizing the tissue and the adipocytes. The cells respond by enlarging and growing in numbers, and that takes time. Full effect is probably 3 months, but you have some effects at starting about 2 to 3 weeks. It's like watching a plant grow. And then 80% of what you're going to be seeing is there at about 8 weeks. And this is from multiple soft tissue studies. So that's my best tips about how to use PRP in the buttocks, about what you can and can't do with it. Hope you find that helpful. I encourage you to just go to the Vampire Facelift or the Vampire Breast Lift website. Look at our directory. We have people in multiple countries and, of course, all over the United States to see you. And all of our people will give you money back guarantees. You have to love with luck.